choosing the right cleaning products is essential to effective environmental cleaning. Different tasks require different products, and understanding these differences is key to ensuring safety and effectiveness. Detergents are used primarily for cleaning surfaces by removing dirt, grease, and grime. They don't kill germs but are essential for preparing surfaces for disinfection. Disinfectants, on the other hand, are chemical agents designed to kill germs on surfaces. It's important to use EPA-registered disinfectants in healthcare settings, as these products are tested and proven effective against a wide range of pathogens. When using cleaning products, always follow the instructions on the label. Pay attention to the recommended dilution rates, application methods, and dwell times. Understanding safety data sheets is also crucial, as these documents provide important information about the safe handling, storage, and disposal of cleaning chemicals. Safety is paramount when handling cleaning products. Personal protective equipment such as gloves, masks, and protective eyewear should be worn to protect against chemical exposure. Always work in well-ventilated areas and be mindful of reducing chemical exposure wherever possible, such as by choosing eco-friendly products that are less harmful to both the environment and human health. A consistent and thorough cleaning schedule is essential for infection prevention. Cleaning routines should be established based on the specific needs of different areas within the facility. High-touch surfaces may require more frequent cleaning, while other areas might be cleaned on a set schedule, such as daily or weekly.